Okay, this is part 6 from Dr Mcdougall, the doctor who fought for you, by me, Pete Rogers. We're talking about obesity and fat. We'll just continue on where we left off last time. This is Dr. Mcdougall speaking here. In 1973, I changed my diet. I switched to from beef to chicken. Then I learned that chicken is about the same as beef, so I switched to fish. Then I learned that fish is about the same, so I ate more dairy. Then I learned that dairy is basically meat, so I gave up dairy. Then I learned that oils were as bad as meat, so I gave up oils and became a low-fat vegan. But a better name for the diet is to be a starchivore. Okay, so that's a good point, because a lot of people think, fish and chicken are good for you. They're all bad. All meat's about the same. And fish is a terrible food. It's very high in fat. It's full of contaminants like mercury and estrogenic chemicals like PCBs. It's very acidic. It's for chumps. And, that Jane Hightower wrote a nice book about, mercury, how all these yuppies were getting demented from eating fish. Okay, continuing on with Dr. Mcdougall. Pritikin taught pretty much the same thing as I teach. Walter Kempner and Nathan Pritikin are the truth tellers. It is impossible to be too low in fat in any naturally occurring diet. The Irish starvation protesters lived for 60 days. They burned mostly fat before dying and only went through about 18% of their protein. America lost the Vietnam War to rice eaters. The omega-3 blood test is irrelevant. That's an important point too, because a lot of people think, I got to check my omega-3s. Don't worry so much about checking. Healthy people eat a healthy diet. They don't constantly get tested for everything. I think that's quite overrated. Okay, taking vegetable oil or fish oil supplements is a bad idea. Okay, that's a big statement right there. Taking vegetable oil or fish oil supplements is a bad idea. The research shows that fish oil is not cardioprotective. Of any part of the diet, vegetable oils are the strongest cause of cancer. Vegetable oils are a major cause of blood sludge, the red blood cells sticking together, which is going to lead to tissue hypoxia. They're all associated with leaky gut, insulin resistance, obesity, etc. Okay, Dr. Mcdougall continuing. Oil gets everything to stick together in a processed food. You fry a potato like a French fry and the salt sticks to it. You fry a donut and the sugar little sprinkles stick to it. The total cholesterol remains the same whether you are fasting or not. Okay, that's good to know. Total cholesterol remains the same whether you are fasting or not. I don't remember the best numbers for LDL. It's enough to just go by total cholesterol. I'm an old country doctor. I just go by total cholesterol. So I usually like Framingham study, Esselstyn study. The goal is by diet alone to be able to keep your total cholesterol below 150 because that dramatically reduces your risk of myocardial infarction. Total cholesterol is sufficient and it is not confusing. Subparticles and subfractions of cholesterol measurements add nothing required for me to help take care of you. Total cholesterol is what counts. The cost for testing total cholesterol is about $10 to $40. Okay, William C. Roberts, the cardiac pathologist, said that the only absolute, unequivocal, independent atherosclerosis risk factor is elevated serum level of total cholesterol or LDL cholesterol. So cholesterol is a major proven risk factor, and it's relevant to repeat that because there's so many people on the internet trying to push this idea that cholesterol really doesn't matter. That's not true. It's well known, and it's obvious why. LDL cholesterol is a bridging molecule. It sticks the red blood cells together, making them more prone to clot. What is atherosclerosis? It's a blood clot. The chylomicrons that also happen right initially after fat absorption from the intestinal tract, they also do the same thing. They stick the red blood cells together. Plus, diets high in fat tend to be low in fiber, and they tend to often be associated with leaky gut, thus increasing the risk of postprandial, bacterial endotoxins getting across the leaky gut, and that's very prothrombotic. The meat and processed food type diets are high in sodium. Sodium is a vasoconstrictor. It narrows arteries. That leads to hypertension. That leads to decreased tissue perfusion. That increases the risk of blood clotting at bifurcations. What else? You're going to be, if you don't eat plants, then you're low in potassium, you're low in magnesium. You lose your vasodilators, you lose your nitrate, plant precursors, nitric oxide for systemic vasodilation. So it's all bad. Okay, for practical purpose, cholesterol is found only in animal foods in significant amounts. Plants can contain tiny, insignificant amounts of cholesterol. Cholesterol is a precursor for the synthesis of steroid hormones, bile acids, and vitamin D. The liver is able to make all the cholesterol the body needs. The liver is also the principal site of cholesterol excretion. Cholesterol is converted into bile acids and excreted into the bile. In general, all animal foods are about the same. A muscle is a muscle is a muscle, whether it flaps a wing, wiggles a tail, or moves a limb. That's an important point. It's all bad. Chicken, fish, turkey, beef, it's all kind of the same thing. It's all high in fat. It's all high in animal protein. There's no carbohydrate in animal foods except for milk, the lactose. Okay, whole flaxseed goes largely unprocessed to the colon, so it can be used to treat constipation. When you grind it up, the fat gets exposed, and there is increased risk that it will go rancid. By the time a person goes on dialysis, they've lost 90% of their kidney function. The studies where they say nuts don't cause weight gain, they were restricting the amount of nuts that people were eating. Nuts are 80 to 90% fat. They put a shell on them for a reason. The higher the percentage of calories from fat, the more likely the person is to become fat. So if you're eating something like nuts, 80 to 90% fat, there's a very high likelihood, especially if you eat them ad libitum in large amounts, you're going to get fat. I like eating rice, sweet potatoes, and broccoli. And this is from The Fat You Eat is the Fat You Wear from the Dr. Mcdougall YouTube channel. Okay, Dr. Mcdougall continues, I'm the luckiest doctor in the world because my patients get well. To a patient, that sounds like a no big deal statement, but the reality is to an internal medicine doctor, their patients never are cured. They never cure obesity. They never cure hypertension. They never cure diabetes. They never cure coronary artery disease, etc. Pills, you can't cure a dietary disease with a pill. The way to cure a dietary disease is to change the diet, and the sooner the better before you develop irreversible damage to the tissues. Low fat, low sodium vegan, it's the diet that reverses coronary artery disease. The low fat is a key point, and oil is liquid fat, so you don't want any oils in there. The Esselstyn diet's the best example of it, but there's also the Ornish diet. There's all the animal studies like the Armstrong study, etc. Blankenhorn did studies on this. The more fat you eat, the more atherosclerosis you get. The Mcdougall diet is starch, much, much, much more so than fruits and veggies. He typically recommends about 90% of calories from starch, 5% each from fruits and veggies. But if a person's trying to lose weight, then to increase the percent from veggies. No animal foods and no oils. When you remove the animal foods and the oils, you remove most of the fat. And for patients trying to lose weight, they should also avoid high-fat plant foods like avocados, coconuts, nuts, seeds, and soy. With aging, a person does not have to develop obesity, hypertension, diabetes, and coronary artery disease. With the Mcdougall diet, people don't get those diseases, okay? All right, so that was from John Mcdougall. Some other references just mentioned here. He's got all kinds of stuff in his newsletter, all about the rice diet, about weight loss, about how artificial sweeteners are bad for you. So, okay, that concludes Chapter 8 on obesity and fat. Hope that was helpful.